Welcome back to New Day Cleveland. Did you know every 23 seconds someone in this country is diagnosed with diabetes? And here with the details is Dr. Brad Lucas from Buckeye Health Plan. This is some good need to know stuff that I think everyone sitting out there should really pay attention to, because it truly affects way more people, I think, than folks imagine.
True. In Ohio, about 12 out of every 100 Ohioans have diabetes. Across the country, diabetes is chronic, life-changing disease that is in many ways preventable. Across the United States, 8 million people have diabetes, but it's important to recognize 86 million have pre-diabetes. So for every one person that has it, there's another 10 people that are close to having it.
And as you just mentioned, it's something that can be easily preventable. There's certain things in life that we can't prevent from happening to us. This we can.
Yeah, the most common type of diabetes that we have, we call type 2 diabetes, and you're at risk if you're not active, if you're overweight, if your diet isn't terrific, if you're eating a lot of sugars, refined sugars, sweets. So getting up off the couch, being active, losing some weight, you're really making some changes on your diet can prevent largely a really destructive disease that can kind of get you all over your body.
Let's go back to the basics here and just explaining what happens with diabetes. What is it?
Our pancreas, our body's not doing a very good job at taking the blood sugars that come into our body through our diet, and we call this glucose. It's an important nutrient for our energy, but our body does a bad job of taking that glucose and putting it where it needs to go properly. It just continues to circulate too high in our blood system. The pancreas makes insulin, and if it's not making insulin, or it does make insulin, but the insulin isn't having the effect on the rest of the body, then that blood sugar stays high, and it starts to, a complex way, it damages blood vessels, big and small, the nerves, that will lead to a lot of problems that could affect our vision, our heart. If you have diabetes, you're twice as likely as somebody else who doesn't to die of a heart attack or a stroke. It affects nerves throughout our body. So our feet, we don't, the vasculature is affected, and you get sores and cuts on your feet that don't heal. You hear of people having amputations. So simply, if you are, say you're female, and you should be maybe 130, 140 pounds, but you weigh 200, if you just cut like 7% of your weight and take that down, say you lose 14, 15 pounds, you've kind of prevented yourself from getting that diabetes.
Wow. So being overweight is one of the #1 factors?
Sedentary.
What else?
And
I mean,
overweight.
what should people be looking for that they might not even realize this is something I should go to the doctor to check?
It's important to have a doctor that's easily accessible, that you have a good relationship with, and if you think maybe there's some friends or family members who have it and you're somewhat familiar, and you think, well, I am kind of sedentary and I'm overweight and I know a little bit about my diet, see your doctor. And there's blood tests you can check and kind of see where you stand, if you might have pre-diabetes or not, through checking your blood.
Buckeye Health Plan too. I know having a good health plan really comes into play.
Buckeye Health Plan, we manage and coordinate care for over 320,000 Ohioans across Ohio, help them find the best care they can get. We have a whole bunch of care managers that really help them understand their diseases or how to prevent disease, and we're just always there for them. Mostly Medicaid, Medicare, and those who are in the marketplace looking for health insurance. That's our population that we take care of.
If you want people to take away one thing from this as far as what they need to know, what would you say the top thing on your list would be?
Find time to be more active in your day. Everybody can find genuine time.
And what do you recommend? How much would you say a day?
Every
Anything's
day,
better than nothing, I'm sure.
Yeah, every day, just start fitting in 15, 20 minutes of doing something. Now, just running around the house or doing your work or going shopping, that doesn't count. Something new.
Okay.
15, 20 minutes of getting and moving.
Getting up and moving. I like the sound of that. Thank you so much, Doctor, for being here. Really appreciate it.